Good afternoon, elite members. We welcome you to the special sessions of the members taking the classes. Today, Mr. Madhu Malati has come forward to explain about cancer and about its treatment, etiology, as well as remedies. So let us take full advantage of this lecture. I once again welcome Mrs. Madhu Malati and start her lecture. Mrs. Madhu Malati.
Namaste, my dear homeopaths. Today, one of our old student of MPHA, Mrs. Madhu Malati, she has completed her MSc and BEd. She is a teacher in science in CBSE school for past 10 years. Worked as a dietitian in Dr. Mohan's MV Diabetic Specialty for 15 years back. He is a old student of MPHA. Previously also she has taken 2 to 3 sessions like this. Welcome Mr. Mrs. Madhu Malati madam. Take the class.
The voice is not audible.
Oh, his voice, she can. Yes, welcome.
For your introduction and welcome. Thank you so much. Namaste to all present here. I'm very happy to see you all after a long gap. Actually, sorry for that I'm not coming regularly for these sessions. Hereafter I try to come regularly. And my heartfelt thanks to Dr. Murthy sir, Dr. Surendra sir, and Dr. Amit sir, Dr. Suresh sir, and Dr. Jayaraj sir, and my friends, well-wishers, Mrs. Lalita ma'am and Mona ma'am, and all the members of MPHA for giving this opportunity. Let us start the session first.
Yes, please.
My screen is visible, sir?
Yes, madam. Yes, visible.
Once again, I welcome you all. You all very well know about the today's topic about cancer. There are many types of cancer out there, but today we are going to discuss about the breast cancer. You all know very well that it is more prone and it is very fastly developing in India as well as in US and other countries also. So I would like to take this topic. Actually, the breast cancer awareness month, every October is awareness month. This year, that means 2024 theme, no one could face breast cancer alone. That means this theme highlights the importance of patient-centered care, including medical, emotional, psychological, and social support through patient navigation systems, while addressing gender and socio-economic disparities in access to breast cancer care. You all very well know about the medicines and what are the psychological, even the patient is taking under treatment also, psychologically we have to love them, we have to kindly, we have to talk with them. So that is very important. And according to the WHO, that is World Health Organization, the breast cancer initiative, the awareness month is the October month, that already I said. So the breast cancer impacts all of us, our families, our friends, our co-workers and ourselves. 1 in 8 women are diagnosed with breast cancer in their lifetime. So here in Alaska, an estimated 540 540 women will be diagnosed with breast cancer in this year, that is in 2024. So that's why we are creating the awareness month as October month. So when is the Breast Cancer Awareness Day in India we are celebrating? So that is on every year October 13th. It serves as an important opportunity to promote awareness about breast cancer, a disease that affects millions of women globally. So to create an awareness, we are celebrating the Breast Cancer Awareness Day on October 13th every year. So you can see the anatomy of the normal breast, the lymph nodes, skin, milk gland, milk duct, reservoir, fat, which is deposited, ribs and muscle. But you can see here the breast cancer after the malignant tumor which has affected the breast means you can able to see here after the fatty tissue you can able to see the malignant tumor. Actually it looks like a walnut shape. You can see here it is a walnut shape. So the tumor may be the size of a walnut and may not be in the lymph nodes. Actually the lymph nodes are nothing but if the lymph nodes are negative means none of the axillary lymph nodes contain cancer, but the lymph node is positive means at least one axillary lymph node contain cancer cells. Now let us see the definition of breast cancer. It is the most common malignant condition of breast. Malignant means cells that grow promptly and uncontrollably. You can see the two types of breast cancer. One it forms in the tissues of the breast. Another one it spreads mainly through the lymphatic system. Forms in the tissues is nothing but it occurs when breast cells mutate and form tumors that can spread throughout the body. This type of breast cancer depends on which cells in the breast turn cancerous. So this is called the tissues of the breast forms the cancerous cells. And the other type is spreads mainly through the lymphatic system. The lymphatic system is nothing but the cancer can spread through the lymphatic nodes on other parts of the body. The lymphatic system to lymph nodes on other parts of the body, and it is also called as metastatic cancer. So these are the two types of breast cancer. You can see the breast tumors also. Malignant means cancerous. Benign means not cancerous. Malignant already know that is the cancerous that causes the cancerous cells that forms. Benign is nothing but that is a tumor is a mass of cells that does not invade neighboring tissue compared to malignant tumors, and also these benign tumors generally have a slower growth rate than the malignant tumors. And also the common examples for this malignant tumors include moles and uterine fibroids. These are the examples for benign tumors. And let us see the introduction. The cancer is a dreadful disease. 80% to 90% of all cancers are the result of the things we do to ourselves. So when breast cancer is the second most common cancer, and breast cancer is the most common malignant condition of the breast. And what are the causes? Let us see the causes. You know very well the lifestyle of the people and the eating habits. Nowadays, the children, they are very much addicted about the junk foods. So on the lack of exercise, and so these are the main causes. And let us see what are the other causes. So the hormonal factors like when the cells come in contact with estrogen, and genetic factors like gene mutation and family history, late period, early menstruation and late menopause, obesity, increased breast density, prolonged use of oral contraceptives, hormone replacement therapy after menopause, alcohol intake or tobacco. These are the examples for the breast cancer. Now let us see what are the signs and symptoms. So you can able to see some new lump in the breast or underarm. So we have to examine after 40 years. Definitely we have to examine every day that any lump formation is there on the breast or not, underarm or not, and thickening or swelling of part of the breast or mass which is hard with irregular borders, and irritation or dimpling of breast skin, and redness or flaky skin in the nipple area or breast, pulling of the nipple or pain in the nipple area, nipple discharge other than breast milk, any change in the size or the shape of the breast. If you are having any one of this symptom, we have to, at the early stage, we have to go and consult the doctor, means we can able to prevent the breast cancer, and you can see the stages of the breast cancer. First stage, second, third and fourth stage, that is the final stage. It spreads all over the body. In this stage, it is very, difficult to save the life. So, if you examine the, after 40 years, every day is, if it is in the first stage or second stage also, we can able to survive, the patient can able to survive through the medicines, allopathy or homeopathy also. Next, what are the clinical breast examinations? Let us see. So, examining the breast and biopsy. If any lump or anything is you are finding on the chest region, means you have to, that tissue alone, they will collect as a sample and they will test whether the cancer cells are developing in the breast or not. So, the biopsy helps to detect the cancer cells which is present or not. And pathophysiology. This is nothing but it is the study of how disease and injuries cause the body to function abnormally. Through this study also you can find out the cancer cells are developing or not. And even the mammography, you know very well, the mammography also helps to find out the cancer cells. And women, if she is asymptomatic, also at the age of 40 years and older, should have a mammogram every year. It is very compulsory to detect whether the cancer cells. So sometimes we can be able to find out at the fourth stage only. So there is no symptoms, or some patients used to say that there is no symptoms, asymptomatic in the first stage and second stage also. Now only I came to the final stage. So we have to examine after 40 years at least once in a year whether we are having a normal or any lump or any formation is there, any abnormalities, what are the causes we have discussed already. If we are having any one of the symptoms, we have to go for checkup so we can find out in the early stage. So let us see the treatment for breast cancer. First one, surgery, radiation therapy, chemotherapy and hormonal therapy. So let us see one by one. At first we are going to discuss about surgery. So surgery, first mastectomy is nothing but you all very well know about this term, removal of the whole tissue. That is the whole, the breast that is removed to avoid spreading all over the body. And lumpectomy is nothing but the removal of if it is in the early stage, the find out means the small part of the tissue which is present in the breast area, they will remove that part away. Radiotherapy, it is nothing but it is given after surgery to the region of the tumor bed and regional lymph nodes to destroy microscopic tumor cells that may have escaped surgery. Why they are giving after surgery this radiotherapy means even a small cell which is escape also they will destroy through the radiotherapy that helps to should not spread again. So they are destroying the microscopic tumor cells also that may have escaped surgery. So the medical management about the chemotherapy, that uses drugs to destroy cancer cells. Chemotherapy is sometimes given before surgery in women with larger breast tumors. Chemotherapy is also used in women whose cancer has already spread to other parts of the body also. They will give the chemotherapy. And the hormone therapy also one of the treatment for cancer patients that slows and stops the growth of cancer that uses hormones to grow. This hormone therapy is also called hormonal therapy, hormone treatment or endocrine therapy also we can say. So now let us see some of the recent updates on breast cancer. So the new treatments, what are they? Let us see. New targeted drugs have been approved to treat breast cancer. For example, the FDA approved abemaciclib, that is Verzenio, as a first-line treatment for some women with advanced metastatic breast cancer. We have studied already. We have discussed about the metastatic cancer. It is nothing but the cancer can spread through the lymphatic system to lymph nodes or other parts of the body. That is called metastatic breast cancer. For that type of cancer, this medicine will be helpful. And 3D mammography. Just now we have discussed about the mammogram, but here the advanced technology we can call 3D mammography. Actually, that old one we can test only the breast tissues, but in 3D mammography, the doctors can examine breast tissues layer by layer. That is the advanced mammography, which can help detect breast abnormalities and tumors at earlier stages. So this 3D mammography helps to detect the layer by layer of the breast. So if any layer, if the tumor is present, they can able to examine at the initial stage itself and they can able to recover also. So it is more advanced and helpful for examining the breast cancer. And cancer vaccines. So vaccines, cancer vaccines are being tested to see if they can help prevent breast cancer from worsening or coming back after treatment. So the cancer vaccines also introduced. And immunotherapy. So these are some of the latest recent updates on breast cancer. So that is nothing but 3D mammography, cancer vaccines, and immunotherapy. It is a promising treatment that trains the body's immune system to fight cancer. So if the immune system is very good in your body, means you all know very well it fights against the disease. So this therapy helps to promising treatment that trains the body's immune system and to fight against the cancer. So researchers are testing whether immunotherapy can be used in combination with other treatment also. So they can use the combination with other treatments and are trying to expand its use to more patients to improve the immune system in the body. And radiation therapy, endocrine therapy, we are already discussed. This is a little detail about that. Radiation is nothing but the researchers are studying whether shorter doses of radiation therapy are as effective as longer doses for early stage breast cancers, and they are also testing whether different types of radiation therapy like proton beam radiation might be better. So in that radiation therapy, advanced nowadays they are the proton beam radiation is also better than the older one because it helps to give the therapy very well. And also endocrine therapy. This therapy is the main treatment for breast cancer. Drugs used in endocrine therapy include tamoxifen, aromatase inhibitors, and luteinizing hormone releasing hormone analogs. These are the latest medicines. Through this endocrine therapy they are giving for the patients. So other recent updates on breast cancer include a study might suggest that oxygen carrying bubbles may improve the effectiveness of radiation therapy. So not only the proton beam radiation and also the bubbles, the oxygen carrying bubbles may also improve the effectiveness of radiation therapy. And also a study found that people who have been treated for breast cancer or lymphoma having a higher risk of developing congestive heart failure also. So a healthy lifestyle can help prevent breast cancer. This includes eating a heart healthy diet, reducing alcohol intake and not smoking, and getting regular exercises. So again, the 5 steps to help detect breast cancer's early stage are: practice routine self-exams, know your risk and family history, visit your doctor regularly, know when to get a mammogram, and follow factory screening or tests. These are the 5 steps we have to remember, keep it in our mind, and we have to follow. And 1 in 8 women in the US will be diagnosed with breast cancer in her lifetime. That is in this year, actually, statistics is in 2024 an estimated 3,10,720 women and 2,800 men will be diagnosed with invasive breast cancer. And in India, let us see the census about India. Most common cancer in women in the world, that is 1 in 8 women diagnosed with breast cancer in their lifetime. In India, 60% of breast cancers are detected at an advanced stage only. Already we have discussed that in the initial stage, even first stage, second stage also, we cannot find the cancer very easily, but at the final stage only we can able to find. Also in that stage it is very difficult to recover. So that's why we have to examine and we have to go for regular checkup at the age of, even nowadays the women can start at even 30-35 years also. And so that see the census also there in this we can see that even the breast cancers are detected at an advanced stage only. So about 1 in 3,000 pregnant or lactating women have breast cancer. So even the lactating or pregnant women also having breast cancer. So what kills breast cancer cells naturally? So far we have discussed about the causes and what are the symptoms and what are the treatment, everything. Now in the natural way, what kills breast cancer cells naturally? So what are the foods we can include in our diet means naturally it kills the cancer cells? Let us see. That is nothing but cruciferous vegetables. So they are known as a potent cancer fighting food. After they are chewed and digested, cruciferous veggies form special compounds that can fight against and prevent you of cancer. So according to the National Cancer Institute, these foods can prevent cell damage, reduce inflammation and destroy harmful cancer cells. Let us see what is meant by cancerous, vegetables. These are the type of vegetables. So a member of the family of vegetables that includes broccoli, Brussels sprouts, cabbage, cauliflower, coral greens, tharli and turnips. These vegetables contain substances that may protect against cancer. So also called brassica vegetable. So we have to check over that these are the vegetables we are including in our diet regularly or not. At least weekly once or twice or thrice. So it helps to fight against. Actually they have given a clear explanation why we should include also. Actually, they are while chewing and digesting, these veggies form special compound. So that compound only helps to fight against the cancer cells. So that is the reason this vegetables helps to protect us from the cancer cells. And the green, what to drink to prevent breast cancer, especially the breast cancer? So the green tea. So green tea contains compounds and various antioxidants that reduce a woman's breast cancer risk. According to a 2014 study published in the World Journal of Clinical Oncology, women who drink at least 10 drops of green tea may be able to prevent breast cancer. So at least we have to see that occasionally don't like to have every day also at least 10 times in a month, maybe. Like that, if you take means, it helps to prevent destroy the cancer cells. Now, let us discuss about the homeopathic medicine, treatment and remedies for breast cancer. Actually, there are many medicines available in homeopathy, but only thing we have to select the medicine. So, for the patient, according to the required to treat the patient, it depends upon the symptoms of the patient. So that is very important in homeopathy. Other allopathy and all we know very well for headache, fever, common medicine is there, paracetamol and all, but we won't give like that. So we have to give the medicine according to the symptoms only. Even the cancer also, for this the cells also, we have to give the selection of medicine is very important according to the symptoms what the patient is having. So some of the medicines of the homeopathy which are beneficial in the treatment of breast cancer and also with the conditions in which they are prescribed are described below. Let us see. At first we are going to discuss about Conium Maculatum 3C. Actually this medicine is prescribed when patients suffering from breast cancer as their hard tumor with piercing pain and stitches. The pain will be very, the stitching pain, if you just prick with the needle or the pin, how you feel, the same pain the patient will have. Or felt in the breast and nipple upon breathing or doing any physical activity. So especially while breathing or doing any physical activities, they will get this pain. So in that cases, we can go for Conium Maculatum 3C. Next, Asterias rubens 3C. It is given to patients in the ulcerative stage. That means when the patient suffers from acute pain in the breast or swelling of the breast, retracted nipples, etc. So this kind of symptoms if the patient is having, we can go for Asterias rubens 3C. And Aztreonam 200. It is very effective in the treatment of breast cancer in which there is an open ulcer, even the patient is having open ulcer with furious discharge and pain, with restlessness, the patient would lose all hope to live. So very depressed, furious means very angry about about her because of this condition. Okay, so this kind of conditions we can go for Asclepium aureum. Next about Antimonium 200. It is also given to patients with an open ulcer with the breast with discharge. The patient feels itching and a burning sensation. So if there is any itching in the breast or if it is a burning in the chest, then go for Antimonium 200. And next about Solanum 200. It is very useful in the treatment of breast cancer with open ulcers. This is also open ulcers, but the other symptoms are vary from one to other medicines. Here we can see in Antimonium crudum, there is a itching and a burning sensation with open ulcer we can use. But here breast cancer with open ulcers and acute pain and burning sensation or seen and the breast or swollen with red nipples. So for this symptoms you can go for Solanum 200. And Phytolacca you can go for Dicandra. Phytolacca Dicandra 200 is an excellent homeopathic medicine for the treatment of breast cancer when the breast is hard and bloody discharge is seen from the breast and the nipples are cracked. So if the patient is having this kind of symptoms, means we can give Phytolacca Dicandra 200. And Turja, it is the best treatment 3C for the treatment of patients with retracted nipples. So here also for Phytolacca they have given many symptoms also, the other symptoms also. It is also common name of Phytolacca is stroke room. The main symptoms, the people who benefit from this remedy experience some of the following symptoms also: painful and hard breast, purplish hue on breast, hard nodules felt in the breast, enlargement of the small group of lump nodes present in armpits, that is either the arms, painful and cracked nipples, inversion of nipples, bloody discharge from nipples, heat and swelling of mammary glands, abscess, that is pus-filled eruption may occur in the mammary gland, nipple pain spreads to the whole body like breastfeeding, painful breast before and during periods. So the patient is having any one of this kind of symptoms, means we can go for Phytolacca Dicandra. And Rananlinum CM. So actually this medicine is very useful in the primary stage. If the patient is the first stage and the shrinkage of the cancerous deposit, and many patients suffering from breast cancer have recovered through the use of homeopathic medicines. which proves the significance of homeopathy in the treatment of the disease. Hence, the use of homeopathic medicines is a good option to deal with the breast cancer. So, the homeopathic medicines are very helpful in treating the breast cancer. So, one of the medicine in initial stages, Nalandrina CM. And pulsatilla. Even the common name for pulsatilla is wind flower. The symptoms mostly, you know very well, this is a female remedy who benefit from this remedy have some of the following symptoms, that is changeable symptoms, sleeping while describing the symptoms, and symptoms better in open air, discharge from nipples, if present is yellow in color and sensitive of organs, fat-rich food, worsen symptoms, suppression of periods leads to hormonal issues, ulcer in the chest region, generalized chillness, mother weeps every time the child is put to breast. So these are the symptoms the patient is having means we can go for pulsatilla latensis. The common name for this wind flower. So again, Asterias lubens, we can see the symptoms and what are the symptoms, and the common name is red starfish. So the common symptoms, individuals who benefit from this remedy have some of the following symptoms, that is nerve pain in the breast, continuous dull pain in the breast which may extend to the left arm and fingers. So clearly each and every medicines we are having the symptoms, it is varying. So that we have to observe for each and every medicine, and if you give this, definitely we will success in the medicines and the patient also will get benefited. So here also they have given this symptom is new when we compare to the other medicines what we have discussed previous. So here we can see that even the pain in breast which may extend to the left arm and even fingers also. So hard knotted glands in the underarm and swelling which is more commonly seen in the left breast, even feeling if the breast is pulled inwards, and retraction of nipples, ulcerative stages of breast cancer, numbness in the left hand and fingers, and symptoms like pain became worse on movements. So these are the symptoms for Asterias lubens patient. Next about Sorinum, already we have discussed. Here they have given the clear, some more symptoms also. That's why I have once again given here. So the common name for Sorinum is scabious vesicle. The symptoms are patients who benefit from this remedy. Let us see: swollen breast, painful breast, sore nipples with oozing of acidic fluid, burning ulceration in the breast and nipples. Discharge is so acidic, so the discharge will be acidic that it burns and exfoliates the glands, severe intolerable itching, ulcers that take time to heal, dryness and eczema, sleeplessness due to excessive itching. So these are the other symptoms of Sorinum patients. And Arsenical malum also already we have discussed. So the common name for this arsenious acid, and the symptoms for this patients, we can see the ulceration of the breast and weakness that is out of proportion to the pain, feel that the person will die of the disease. So actually this fear will be most common in all kind of diseases, not only the cancer, even any one disease will get, even fever, eye fever also, that thought will comes in our mind. So the fear of that person will die of the disease. So if the patient is having this kind of symptom means we can go for arsenicum alum. Anger and anxiety that taking the medicine is pointless as the person is going to die, and the individual is restless with pain and keeps moving from one place to another, extremely offensive and bloody discharge from nipples, burning sensation in breast, disturbed sleep due to anxiety, symptoms get worse in wet weather. So if the symptoms getting worse in wet weather means we can go for this, and after midnight and from cold drinks also. And symptoms improve on application of heat. and Tuja acantharis. So the common name for this Arthur Vitae. The symptoms, warts on the skin. If the patient is having warts on the skin and tearing pain spread all over the body and in the breast, and also pain worsens on resting and improves in dry weather, rapid weight loss, lumps in breast, sore and painful lumps near nipples, predominantly left-sided symptoms. So the patient is having the left-sided symptoms and the warts having on the skin and rapid weight loss and cannot tolerate winters and cold weather, retraction of nipples, pain in the left ovary. So if the patient is having this kind of symptoms, we can go for Tuja. So the best homeopathy medicine, so far we have discussed about the breast cancer and its, the homeopathy remedies for that, and already we have discussed about the benign tumor. So for that also some of the medicines are there in homeopathy. Let us see what are the medicines. So just we are going to discuss about only few medicines about the benign tumors. So what is meant by benign tumors? We have discussed that it is generally having slower growth rate. The common examples for this type of tumors are moles and uterine fibroids. So let us see some of the homeopathy medicines for this kind of tumors. So first one, Calcarea carp. So by and large, the person requiring Calcarea carp is obese. So that we all know the person who is obese used to give this medicine. So especially even in this kind of tumor, the patient is having and very obese, the patient is obese, means we can go for this, and different established characteristics and behaviors of the person should be checked before its use. The first among this is the inclination to sweat a lot on the head. The second is his or her reaction to the chilly air. And last comes the unique request in dietary patterns like a desire for boiled eggs and citric things like lime. So these are the characteristics that the patient is having means we can go for this kind of medicine for benign tumors. And next about the sulfur. So in Calcarea carp we have discussed about the patient who are obese and the sweat, the first among the inclination to sweat a lot on the head, the second a reaction to the chilly air, and last comes the unique request, that is the dietary patterns like a desire of boiled eggs. Okay, so now for sulfur, what are the characteristics? Let us see. So one of the effective homeopathic medicine for a benign brain tumor, especially for benign brain tumor, sulfur is a similarly capable prescription like Calcarea carp. However, which medicine will suit with which the person relies on his or her constitution, much of the same as Calcarea carp. Sulfur has exceptionally protected symptoms that a person should have in order to take it, and people requiring sulfur feel hot sensations in their body. The warmth might be felt more in the palms, soles and on the head. For the most part, the skin remains dry and looks filthy. So these are the symptoms for the sulfur patients. The warmth might be felt more in the palms, soles and on the head. So these are the main symptoms. And belladonna. So the homeopathic medicines for benign tumors, belladonna is valuable when lipoma is difficult. So the agony may intensify on touching the irregularity. Here belladonna will help in giving elevation from agony, furthermore dissolving the lipoma. So the belladonna helps very much in the cases of, the valuable when the lipoma is difficult. At last, Tuja also helpful in treating this kind of tumors, that is the benign tumor. Tuja is a homeopathic medicine that is of great help in treating benign development any place in the body, and Tuja has an intense capacity to scatter the fatty accumulations in the body. So it is having a capacity to scatter the fatty accumulations wherever which is present in the body. In case a man with this tumors has high cholesterol levels, the utilization of homeopathic medicine, Tunja is exceptionally advantageous. So it helps in the cases of the person who is having the tumor with high cholesterol levels. So and this is the drops, 3S, that is limbs and tumor, we can use it, add it 48. Actually for supporting treatment of swollen lymph tissues and inflamed glands, modes, helps cleanse and detoxify the body and support the treatment of cancer adjuvant. Actually whatever medicines with the help of the doctors only have to take, we should not go directly to the shops and we should not ask medicines. According to the symptoms, whatever we are having, according to the what are the signs and symptoms for. To that only doctor will prescribe the medicine. But we are directly sometimes go and buy the drops like this and all. It is not advisable. We always consult homeopath and we can buy the medicines. So conclusion. So these results indicate that homeopathy can offer a valuable addition to mainstream conventional therapy for breast cancer patients, possibly helping to improve compliance and therefore long time survival. Compliance is nothing but it is abiding by a set of rules. So there are certain rules and regulations are there in homeopathy. If you follow that, definitely we will get success in that. Even the patients also can recover. So hope is the decision of each mistake. Life for life, hope for all. Thank you so much for patiently listening. Thank you all once again for giving this opportunity. Thank you. If any mistakes I made, sorry for that, sir.
Thank you, madam, for a nice lecture, informative lecture. No doubt, I am having, apart from polio, you started for metastatic breast cancer. Is carcinosin also one of the medicine used?
Sir, let us ask Dr. Murthy, sir. Sir?
Yes, yes.
Sir.
I'll discuss that one. Mr. Sashidharan is asking something.
No, specific word is metastatic breast cancer, apart from polio and a number of medicines, madam has suggested. And is carcinosin also one of the medicine?
Sir, carcinosin is one of the medicine for general cancer, for all, any type of cancer from top to bottom, carcinosin is the medicine. If it is somewhat second stage or everything, carcinosin in higher potency we can give weekly once or weekly twice. Carcinosin is one of the best remedy. It is not specific only for breast, it is specific for so many areas.
Okay. Thank you.
And I will talk that one. Our Sridhar sir also will have an idea. Mr. Sashidharan, I think you have raised your hand. You can ask the question.
Thank you, Mrs. Madhu Marathi. You've given a very nice lecture, clear lecture. But cancer is not as easy to cure, though we have got defined medicine, proved medicine. Why? Because behavioral element, though the physician chooses the medicine, the recipient doesn't follow the restrictions. It's very difficult if one doesn't follow the rules or the definite criteria that has been suggested. For example, breast cancer. They must have some medicines given according to the symptomatology. They are also advised what to take, what not to take. Whatever be the present modern drug is carcinosin, they know how to prepare from the very diseases. It cannot be taken regularly. It has to be taken once in 15 days or once in 10 days, 200 potency, 1 day with liquid doses. Throughout the day you can take 3 or 4 times. No other medicine for 10 days. But you can go to medicines that according to the other problem that is creating, that is indigestion. Heartburn you can take, China you can take, pain you can take, arnica or magnesium phosphoric and biosol, but not much, because the medicine has to act, and above all, the cancer drugs are long duration drugs. For example, arsenic amalgam, nitric acid, sepia, chelidonium, euphorbium, sulfur, nitrate, thuja, nitrate, calcareous nitrate. This can be taken intermittently according to the conditions of the patient. Here, the physician should be more careful. He cannot prescribe more medicines. More medicine. He must allow the medicine to act. Allow the medicine to act. By doing so, the arrest of the prognosis of the disease. Here, when a well-chosen homeopathic remedy according to the symptomatology which are following the main drug will give you solace. It will not allow the carcinogen cells to spread. As he has said, lymphatic vessels are the root cause for spreading the cancer. Virus. It is not spreading through blood except it is in the case of blood cancer, because blood has got resistance, it filters, so the spreading of or development of cancer is less when compared to passing through lymphatic fluids. And one more thing is taking drugs, taking chewing tobacco, they may not cause breast cancer, breast cancer, but they may cause other regions. They may cause symptoms in the other regions. For example, if the breast are resistant to orienting, then it will avoid accumulation of the cells in the breast. And the first symptom is swelling of the breast and the hardening of the breast cells. At that time, you should take precautions. Phytolacca, calcarea carb. See, calcarea carb work as prophylactic as well as fighting the cancer, because it is a multi-voltage, like that sulfur. Sulfur can be taken only when necessary in the case of breast, whereas phytolacca can be taken then as other medicines indicated like arsenical, phosphorus, Apis mellifica and alumina is the best medicine for cancer of the breast. Like that, we have to use just in case. We have to take the main medicine when the symptoms changes in the body, the complaint given by the patient changes, then we have to give other medicine. You cannot so easily prevent the spreading of the cancer cells unless you are taking most important steps like regular dieting, regular medicine taking. See, when the cells in the breast becomes so hardened and ulcerated, when clinical tests indicate that it is a deep acting and very thickened one, they only suggest removal. We have got no second opinion on it. In the case of homeopathy, there is no second opinion on that. When invasive foreign animal is so deeply seated, no other go because it should not further damage the other organs. Carcinoma, no doubt it may be the most recently spoken word, that is for 5, 10 years, 15 years later. But homeopathy has got root causes. We got medicines. We are given medicines like sulfur, calcarea carb, arsenic alum, acid nitric, Apis mellifica, euphorbinum, etc. These basic medicine, when it is taken for other purposes, for example, for liver problems you take ceridone. It is not going to stop with that liver. It goes into the body and try to stop the creation of carcinoma cells. If it is there, it will try to rest. When genes are affected, what is a gene? You know mitochondria. Mitochondria is divided with many characters. Mitochondria is in the cell. Cell has got a nucleus. Plasma. There, mitochondria is present. There are the fighting agents as well as protecting agents. If those, every mitochondria has got genes. We imbide the characters from our family generation tree. So whenever there is a mistake in that, it gets affected. So infirmity, deformity, or many problems that arises for the children, that is considered to be root cause. The sulfur medicine that we take try to change any morbidity in the cell as well as mitochondria. Sir, have you got proof? Have you got proof with this? Yes, we have got proof. Without proof, no one will accept this. In the modern days, it is again and again proved that whatever the honeymoon period and his followers have introduced for symptoms like cancer, particularly breast cancer, because at that time breast cancer only was not frequent. These medicines have helped. So, of course, you can take more action on different parts of the body by addressing different medicines. Oriental Golem, that's a very beautiful medicine, but it is not available in the market. It is very rare medicine. It has been taken only one drop in a big teaspoon of water and no medicine for 2-3 days. Though it is mother tincture, it acts very effectively. That's right. Like that, homeopathic medicines, when given at the proper time, wipes out. That is, they go to our original thing, remove the morbidity from the body. Concept of homeopathy is there in every medicine of the homeopathy, including carcinosin, the nosol, because all the nosols are similar to the other vegetable kingdom or chemical kingdom or metal kingdom medicine prepared equally act. They don't suppress any disease, any virus, any morbidity. So carcinosin taken will remove the carcinoma cells slowly, but when the more and more cells accumulated and become chronic, it is very, very difficult to accept invasive surgery. Yes, I will hand it over to Murthy sir for his continued lecture. Thank you, Murthy sir.
Namaste, my dear homeopaths. Is my voice audible?
Yes,
Yes, sir.
yes, sir.
I must be thankful to Madhumalati madam. She has taken excellent subject, cancer. Nowadays, so many people are very afraid of those things because of the fear. People are not at all curing themselves. Here she has given excellent medicines also. I don't want to repeat all the medicines. But main drugs are conium. First and fundamental drug is conium. See, we should not take the case into our hands. When the patient is in another therapy, let him continue that one. Ours is a supplementary. We will reduce the symptoms because our homeopathy is based on symptomology. So whatever the symptoms the patient is telling, accordingly our Madhumalati madam is given the drugs. But generally, if any person comes, we will give conium. After that, what next you will take? After conium, we have, first of all, patient must have certain, we have to create a confidence in our treatment. So conium first. Second one is bryonia. Second one is bryonia, which is totally affinity to breast, and any pain or anything is there, it will reduce. And the fear conscious, though it is not much, just like arsenic album, the fear on dealing the same subject in her mind, that also it will reduce. The third one is Phytolacca decandra. These three medicines we have to start. Like that we have to give minimum 10 days to 15 days. A little change, like 5% to 10%. Mentally she will be somewhat, okay, I will continue this one. Then only you have to think. But here you should not forget whatever the medicine you are giving. Calcarea floor is the most important in 6x. You have to take twice a day continuously. You should not forgo. And the supplementary always, Madam has told adult number 48. That is one of the best remedy. It is a supplementary only. Palliation. That also we have to give. It is a German medicine. Adult 48 with this calcarea flow. We have to give a long term. So after conium, bryonia, Phytolacca over, there are certain medicines. Scaphoperia nodosa. Scaphoperia nodosa. It is one of the best remedy for breast cancer. And Tarantula cubensis. Tarantula cubensis. This is also one of the remedy. Better read and give. Good remedy. And one more thing our Subhendra sir has told. Euphorbium. Euphorbium is one of the best remedy for so many cancers when the pain is abnormal. When the pain is abnormal, the person will the patient will keep hand on that area always. At that time, some people will tolerate the pain, but certain people cannot tolerate. At that time, along with Asteria rubensa, you can have to give euphorbium. This is also one of the best remedy. And say our Subhendra sir has told another drug, very rare drug. It is not available anywhere also, but it is a good medicine. It is, though it is not specifically meant for what we call breast, it is for stomach cancer. Ornithobulum. Ornithobulum, that is also one of the best remedy, but we have to give very cautiously. The pain will reduce and the case will revert automatically. This is a very rare remedy, we need not use that one. And one other thing, calcarea corp we are giving. When calcarea corp we are giving, you should not give immediately sulfur. Please note down. If we give after calcarea corp immediately sulfur, means the case entirely it will reverse. The person will go to hospital only. So better when you are selecting sulfur, you must remember that there is not calcarea corp connection. After certain medicines, after calcarea corp, certain medicines will work. After that you can give sulfur. And one more thing, because the cancer chapter is taken by our madam, in 90s, when I was in MPHA along with Surendra sir in our MPHA clinic, we are having our guru, Tyagarajan sir, Mr. Tyagarajan. He is a very nice gentleman. He will study the case very, very meticulously. He will note down all the symptoms. He will ask so many questions. It is just like interrogation. And he will visit the patient's house because he wants to see how the patient is living there. What are the other circumstances? Mental symptoms, anything will come. After that, he himself will prepare. The medicine he will prepare. Generally, when a case comes to him, means he will give first sulfur 30 morning, Naxomica 30 night. This medicine minimum 3 to 5 days he will give. After that only he will select the general medicines. So, because so many therapies, so many medicines they have taken come to us, to neutralize that one, morning sulfur 30, night Naxomica 30, he will give 3 to 5 days, then only regular medicines he will give. That is way of so many previous doctors, senior most doctors have followed the same therapy only. Here, our gentleman has asked about carcinosin. Carcinosin is one of the best drug for cancer. You can give intermittently in 200 potency or higher potency, weekly once or fortnightly once. If you are higher, further higher means be fortnightly. Otherwise in 200, weekly twice we can give. That is also one of the best remedy. When carcinosin you are giving means you must be very careful and always you give certain tonic to give. Hydrastis is one of the best tonic. You can give hydrastis in mother tincture, and alfalfa mother tincture you can give, and any 5 parts tonic or syrup, whatever it may be, we can give that one. Pulsatilla, generally we have to, when the patient is regular to us, when a patient, we have to ask, when after pregnancy, when you are giving lactation period, are you having any pain while giving the milk? If she tells that one, yes, at that time I suffered some breast pain while giving lactation period, at that time you have to select Pulsatilla, that is the surest medicine. Along with calcarea flour, if you give Pulsatilla, excellent medicine that one. That will work excellently. We have to go back to that time, that is 10 years, 15 years back. You have to ask this one. If she tells yes, at that time of lactation period, I felt pain in the breast while giving milk. If such is the case, Pulsatilla is the only medicine, excellently it will work. Some people, the breast cracks will be there, some oozing will be there. At that time, creosotum and graphitis, these two medicines are excellent. Creosotum and graphitis. When there is a crack, from there some oozing is there. At that time, creosotum and graphitis are the most important, preferably creosotum. Graphitis is only when other skin symptoms are there we will give. Otherwise, graphitis is not necessary. In folding, when folding area any skin disease is there, at that time graphitis will work. When hairy area and folding areas, if any skin symptoms are there, graphitis will work. Otherwise, you can give this one only. Creosotum, when any open wound, any oozing is there. And she has told, Madam has told so many things. And Melandrium, of course, good remedy. Thuja is one of the best remedy. And what she has told, yes, Sorinum, Arsenicum album, Asteria rubens, all these things. Arsenicum album, of course, you know pretty well, that is one of the major drug. Nowadays, any type of disease, everything is coming to us because of the so many external influences. At the time, Arsenicum album and Epismel, these two medicines will work excellently. They will go together. You must remember, Epismel, Arsenicum album, Aloes. These three medicines are just like friends. Or Epismel, Arsenicum album, Belladonna. Three are best remedies. Arsenicum album, Belladonna, Baptisia. This is also one of the trio, excellent trio. Arsenicum album, Baptisia and Eupatorium perforatum. So many viruses, it will work excellently. So with this, I think our chapter is over. Any doubts are there, please ask. Because now today is Surendra sir also free, I am also free. You can ask any doubts. Otherwise, I will ask one question, whichever you want. I will ask one question. Any cancer patient or any this type of life threatening disease is there, there is some blood problem will be there. Blood is not pure, blood has to be purified. For that, what medicine you will give? For blood purification, what medicine you will give? Very good, thank you. Echinacea is one of the best remedy. This can be given inside also and externally also with little what we call oil or little water we can wash it. When you are giving externally, Ledampal, Calendula, Echinacea, 2 drops, 2 drops, 3, total 6 drops in 1 tablespoon of water you apply in the affected area. Echinacea, Hydrastis, Alfalfa, these 3 mother tinctures put together 5 drops in a glass of water daily twice. If you take, your blood purification will be excellent and stamina will increase slowly because of alfalfa and hydroxys.
So
Anything?
how many drops are each?
Each 5.
5 drops.
Yes. Each
Sir, for children at the age of 15 years or less than that?
what is the disease? Same cancer.
No, sir. For normal, the blood, the children having what?
If the children is less than 15 years means you can take any competent company patent drug. Blood purifiers are available. Now all companies are preferring. Preferably there will be this echinacea will be there. Echinacea hydrocodone combination generally will be there.
Okay, sir. Thank you, sir.
Even hydrocodone also one of the best remedy. Hydrocodone, echinacea, alfalfa, all these things. When the patient is very much irritable and thinking of his disease not curable, at that time you can give Avena Satyava also. Make him confidence, that's all. Only thing, you have already told what diet we have to follow, like that we have to give him confidence, because everybody will have one or another disease. Only cancer it is coming, otherwise there are so many life-threatening diseases are there, incurable diseases are there. No medicine in any therapy will be available. They have to live with that. But they should not fear. As challenging we have to go. We are seeing teenagers, we are seeing 20 years, 25 years girls and boys, they are taking regularly what we call diabetic. They are taking medicines. They are going for dialysis weekly once. At that time they will see TV, they will see WhatsApp, they will read some books. They are living. I know so many people in software company having so many diseases and they are living without anything. Let it be. It is one of the friend like that. It's a companion in our life. So only thing, our mind must be very strong, willpower must be there, and we have to let it go. Whatever it may, I live. So for that only we have, our mind must be concentrated on other things. So many assignments we have to take, so many things, other things we have to take. Or if you are free means like me, free, anybody free means we have to go to some service areas. We can do service. In that we can get our stamina more, because we will see so many people who are suffering in a different way. Any other question? And few more things, we are having calcarea iode is there, carbo animalis is there, and lepis albus also there. These 3 drugs also will work for cancer. But don't forget, if pains are abnormal, including bone pains, you can go for E4BM, EPHO, EUPHO or BIUM, E4BM. That one along with Asteria rubens. These 2 medicines. What, madam?
This blood purification will set some medicines for 5 hours, everything, these 3 drops. That is, for me, normally time also they can take.
Which one, madam?
For blood purification.
Blood purification, better to go for a patent drug. So many companies are making. Yes. Can you give guarantee any person is there? Maybe 5% people are, there is no impurities. All are having impurities. Purified blood is not there.
So about 65 many of us are having diabetes, BP,
Daily one dose you can take.
blood purification is something different, not activities quickly. That's why I'm asking, is it advised for all?
Yes, it is advisable. It is advisable. Because I am giving so many people along with chelidonium also.
Okay.
Because blood purification has to start from liver. You should not forget that one, because we are taking all processed food.
Yeah.
Whatever the food due date is over, it will go to again mandi. There again they will put it in, put some processing, and again they will throw it us. Otherwise, I am 72. In my childhood, that when I am college studying, starting my job, at that time we will in our house we will purchase rice and dal for 6 months to 1 year. Nowadays, if you purchase rice within 2 months, you have to use it. Otherwise, you have to throw. Everywhere expiry date is there. So many things are processed. Our food itself is not giving any health to us. Another thing, junk. Junk food not only to mouth, junkness to our mind also.
So, I think it's about 65 minutes.
Anybody, madam, from 15 years onwards till age over, at that time blood purifier you can give always. You see what is that? You are taking inji, what we call ginger, dry ginger and wet ginger. All these things are blood purifiers only. You are taking what we call pasupune antaru sir English lo, manjal. What do you call in English?
So, the garlic is little.
All these things.
To make a food is little hollow, I don't know.
My voice is hollow.
Sometimes I have to make it.
Oh, sorry.
My question is only generally for all you can take in the general that was only anything.
No, you can take blood purifiers, any patent drugs you can take. Minimum 2 months, 3 months, it is better. We are having liver tonics. So many liver tonics are there. SBL Live Tea is there, and so many companies are making liver tonics. That also daily 1 dose 5 ml you can take for minimum 1 month. Everything will separate our blood purification.
Thank you.
Thank you. Any doubts? Otherwise, we will close the class.
Live Tea by SBL, is it okay, sir?
Okay. Even adult company also some liver tonic is there.
Yeah.
You can take. So always one dose is always good, sir. After a certain age, we have to take certain tonics to improve our health.
Yeah, okay.
Because nowadays even in allopathy doctors are giving pyobiotics or something like that. Because gut is entered into our system. Previously it was not there. 10 years back nobody was talking about gut. So system, our digestive system has been spoiled totally. Okay, sir. Thank you very much. We'll meet next week. Thank you very much, Madhumalati madam.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you, sir. Okay.